Hello, my name is Dr. Phil Lanoux, and I'm going to talk to you about perineural injections. What perineural injections are is they involve injecting a solution of 1% lidocaine that's diluted with 5% dextrose around or very close in close proximity to nerves that have been irritated or potentially entrapped. So how this works is a lot of times you have superficial nerve fibers all over your body, including multiple up in your neck, low back, everywhere. They're all over, they innervate our skins. So sometimes what happens is when you've had an injury or you've had some kind of something that's thrown your body out of normal, what happens is these nerves a lot of times get entrapped where they kind of get stuck. Sometimes it's just right underneath the skin. So what we do with this technique is you map out the nerves, pull out your old anatomy book, look at the superficial nerves of the body. Luckily we've been doing this for a while so we kind of know what they are without looking at our book anymore, but it never hurts to refresh. And then we're able to map out and press on the points where the nerves branch out, and if those points are tender, which a lot of times when they're tender they feel warm, they feel sticky, and then when we press on them, a lot of times the patient's like, yes, that recreates my pain. Once we map those out, we mark those off and then clean you up, and we inject right underneath the surface of the skin, occasionally a little bit deeper, the 1% lidocaine and the 5% dextrose. And you might ask, why are you using 5% dextrose, which is also sugar? The reason why is because there's some research showing how 5% dextrose, when injected onto or around nerves, it actually resets this specific kind of pain receptor within the nerve. It's called a TRPV1 receptor. So when you inject the lidocaine and the 5% dextrose around that nerve, one thing what it does is sometimes it creates space for that nerve. Another thing that it does, which sometimes may be considered more important, is that the 5% dextrose binds to those pain receptors. It actually resets them, sends a signal back along that nerve to the spinal cord, and causes reflex relaxation to all the associated muscles along that track. I personally have had this done to myself, and I've had great effects. As far as how soon did I feel it, I felt mine within probably 30 seconds to a minute. There are some patients that it does take a couple days to set in. Others, they notice immediately, they feel less tight, less tense, less pain. Sometimes this treatment does need to be repeated. Occasionally there's people that only need one treatment and they feel great. Sometimes people need up to 12 treatments at 1 to 3 week intervals. It just kind of depends. A lot of times we use it in adjunct to make sure that your body's structurally aligned, and if you still, after we've aligned you properly, have irritation along nerve fibers, we end up injecting the 5% dextrose, which is part of that lidocaine solution, along those nerve fibers, and that allows those nerves to calm down. And we've had great results with this. We often use this with patients that have been in car accidents. With whiplash injuries, it's very common to get irritation along the dorsal rami, which are the superficial nerves along the neck and the low back as well, the superior cluneal nerves in the low back. As we do this treatment, most of the time, I would say it's very rare when patients don't show improvement. They feel much better, they're happy, they get better faster, we get them back on their feet, and back to normal function, enjoying their lives. So I hopefully this answered some of your questions as far as perineural injections. We look forward to seeing you at our clinic. Thank you.